Hey, Dr. Doug here at Bodyworks Physical Therapy. Hey, we want to talk to you today about headaches and TMJ people. I've probably seen 6 or so over the past probably 3 or 4 weeks with a combination of TMJ issues and headache issues, and we're seeing some nice results. I think we figured some things out. When we see a TMJ patient or things with pain like right in here, what we're figuring out, that's a lot of times not the problem, but that's just the squeaky wheel. And there's areas that refer pain and make this thing kind of squeaky, so it causes pain in the TMJ area. But what we found, so what we found is when we work in different areas, it actually affects the TMJ pain. And what we found is when we work here in the upper back, and especially in the neck, and especially we found trigger points and joint issues between your skull, C1, C2 up here. This whole area refers pain to the TMJ. It also refers pain for headaches. We have a lot of patients that have headaches, sitting at their desk all day, looking through their bifocals, and they're just crunching this down, and they get headaches that start here, come over the top of their head, and go up over their eyes, and also up into their jaw. The other thing we found out is when we work on some trigger points here in the masseter muscle and the pterygoid muscles, it really opens the jaw up. They can move, it doesn't click. The ear pain's gone, the headache pain is gone here. And so we just want to pass that along. So if you know somebody that has headaches or TMJ stuff, put their name in the comments below, send it over to them, and have them come see us, because I think there's a lot of hope for people that have chronic headaches, chronic TMJ issues, to get some relief in their life. And if you have any questions, give us a call here at 558-8808.